Good evening, ladies and gentlemen. A warm welcome to all the esteemed participants to the second day of ATAL Online Faculty Development Program on Artificial Intelligence and Digital Technologies for Sustainable Healthcare and Medical Technologies, organized by the Department of Electronics and Instrumentation Engineering of Institute of Technology at Nirma University, Ahmedabad. I'm Apurva Shah, your host for the day. I welcome you all. On behalf of the organizing committee, I extend my heartfelt welcome to each one of you. Your presence is a testament to the commitment we all share for continuous learning and professional growth. The overarching theme of today's first session is to explore advanced technologies in healthcare and engineering, specifically focusing on behavioral multi-parametric pain assessment system. Without further ado, let me introduce our esteemed expert, Dr. Narendra Londhe, a distinguished faculty in the Department of Electrical Engineering at the National Institute of Technology, Raipur. A scholar with an illustrious academic journey, he earned his bachelor's in engineering from Amravati University in 2000, followed by an MTech and a PhD from IIT Roorkee in 2006 and in 11 respectively. Dr. Londhe brings over 15 years of exceptional academic and research experience, a prolific contributor to the scientific community. He has authored over 170 articles in spanning renowned journals, conferences, and books. His research expertise lies in cutting-edge domains such as medical signal and image processing, biomedical instrumentation, speech signal processing, biometric intelligent healthcare, brain-computer interfaces, artificial intelligence, and pattern recognition. Dr. Londhe's contributions have earned him prestigious accolades from esteemed organizations like the Taiwan Society of Ultrasound in Medicine, the Ultrasonic Society of India, and NIT Raipur, and holds senior membership in IEEE. His contributions continue to shape advancements in cutting-edge technologies and inspire innovation. Please join me in welcoming Dr. Londhe, a visionary in advancing healthcare. Dr. Londhe, over to you.
Okay, thank you. Thank you, Apurva, for the introduction. Very good evening to everyone. And this is really a nice time that the session has been organized because all of you are relaxed and quite off duty now because nobody is having is not engaged or not having any thoughts in such a atmosphere or in such a state of mind receiving something what I did in my recent time will be a really positive. I expect that. Okay, so basically as Apurva has said that yes, what is the topic of my presentation today in this ATAL online faculty development program is behavioral multi-parametric pain assessment system, right? Because as we know that whenever as the theme of this workshop, this development program is related to sustainable healthcare and medical technologies, as you people are aware of it, and you people are listening the different experts from yesterday, right? And in the line of that, many of you have given the might have given the presentations related to some medical imaging or medical diagnosis or maybe some medicines as well. Okay, so in that what we am I audible?
Yes sir, yes sir.
Okay, so in that what mostly the data, the medical related data you might have seen, okay, that the people are working on that data like MRI images, CT images, X-ray images, or maybe some ECG, EEG or something like that, right? So when I was doing my work on this similar kind of data sets, that time I come across one very important problem that whenever the people, those who are reaching to the hospitals, okay, their primary indicator of any discomfort to their body, okay, that is pain. It's not it's because they are not aware of it, whether what kind of, why it is happening, but they complain about the pain first, and it is a most common indicator of the indicator that is actually mentioned by the patients to the doctors. So in that, in with that motive, okay, why that pain is there and how we people can actually assist our people from the medical fraternity to provide them an automated methodology to assess the pain. Okay, with that thought, actually I submitted one project proposal to the SCRB in the year 2019, and that was this behavioral multi-parametric pain assessment system. So basically we worked for around 3 years, okay, on this topic, and finally we come up with a very fruitful solution to this particular problem, or to this particular objective. What I said is the pain assessment. Okay, now let's discuss about it. What is the idea, how that why this pain assessment is required, and why we have indulged into this kind of work. Okay, we all know that it is, as I told you just now, that it is a primary indicator that every patient tells in the beginning of the in their visits to the hospitals. What basically it is an unpleasant sensory and emotional experience that patients experience, that there is some sort of uncomfort, unpleasant uh, is happening in the body, and that, or this kind of things, maybe in cases of where you people are having some fractures or having some accidents, in that cases also the pain rises, but that is because of majorly because of the potential tissue damage. Okay, so these are the reasons of pains that uh, due to which people experience the pain and they reports the pain. Okay, now why pain assessment is required? As I just told you, that pain has been described as one of the chief complaint for around 52.2% of all the patients visiting any emergency department. This is a study conducted by one of the scientists, and he has mentioned that it is almost 52.2%, whereas only 34% of them were not related to pain. Okay, they may be going there and saying that yes, it's not about pain. They have went for something, means some particular thing, and they have been diagnosed with something else, but they are not suffering from the pain. Okay, even another one of the scientists says that, which is Gregory et al. What he says that the acute pain is a significant symptom in hospitalized patients. Okay, up to 35% of the patients report severe pain. Okay, and approximately 50% patients reports pain. Okay, so different scientists have actually analyzed that this pain prevalence or pain presence in the hospitals has been reported by the patients, mostly by all the patients. In fact, here it has been said that 83% of them. So that is why this, if we, whatever the medical diagnosis or treatment is there is actually conducted at the hospitals, it is nothing but actually management of that pain. Okay, so this has, in order to have that diagnosis, proper diagnosis and treatment of the patient, there is increasing the need of the pain management. Okay, and let me tell you also one more thing. There are some people are having chronic pains, or they are having persistent pains because of some lethal diseases they are having, like cancer, HIV, cardiovascular disease, or maybe nerve damage, and they are actually experiencing the pain for on the regular basis. This kind of persistent pain are actually this this provides a lot of discomfort to the patient, to their family members, to their friends. Okay, and treatments like such as surgery, chemotherapy, or radiotherapy also often causes the pain. So the workplace, actually wherever this kind of people works, or those who are suffering from the chronic pains or kind of persistent pains, okay, they also lose uh, that workplaces has loss of productive employees. Okay, and there is economic loss is also there. Okay, so this all has been reported by the scientists, and they have mentioned that this pain is a very primary indicator, and mostly this pain is need, whatever the medical diagnosis and treatment is there, it starts from the management of the pain only. Okay, And that is why this pain assessment is very important. If you are able to recall, when you, many of you might have, for some of the reasons, might have visited the hospitals, and you might also complain with the first complaint to your doctor with the first indicator that, sir, I'm having a stomach pain, or I'm having a chest pain, I'm having some kind of pains, right? And then doctor decides that yes, I have to see that how severe that pain is. So many times the doctors actually analyze or assess that pain by using some of the very manual measurement methods. Like you can see here, this is the visual analog scale. Basically they just, by looking at the faces, they can just understand, or they, like if this is the face, is if facial expressions are something like this, there is no pain. If the facial expressions are something like this, little bit pain, little more pain, then this is hurts more, this is hurting him a lot. Okay, and this is the worst. If somebody is crying and uh, uh, then we understand that he is in a severe pain, extremely severe pain. Okay, so whatever these methods are there, these are all actually subjective techniques, right? Even there are, this is on facial also, or there are many places where they actually use the numerical rating scale also, that they ask the patient that how you will rank your pain on this scale. Okay, and based on the input from the patient, they actually do the marking here, that 6, 7, 8, whatever it is, and they say that yes, as marked by this, then they starts the diagnosis and the treatment of the patient. Okay, so this is whatever the methods are there, these are actually subjective methods are there for the measurement of the pain. Now, okay,